Good morning or good afternoon, depending on where you are joining us from. My name is Melissa Faulkner, the VP of Marketing. We are the Digital Health Hub Foundation, a digital health accelerator at the Worldwide Center for Healthcare Innovation. Now in its sixth year, our awards program is dedicated to identifying the most transformative, disruptive, and innovative companies that are shaping the future of healthcare. This year, out of over 1,500 applicants, 300 were named quarterfinalists, and we've narrowed it down to our 150 exceptional finalists. Today, we are proud to present our 11 Food as Medicine finalists, leaders and companies who are truly revolutionizing the industry. As a reminder, this session will be very fast-paced as we have 11 companies to present, but this is only a small taste of what these companies have already shared as part of their application. If the audience has any questions, please feel free to drop them in the chat and we'll try to get to them. I would now like to introduce Mark Goldstein, one of our executive producers and chairman of the foundation, as our host of this session. Take it away, Mark.
Thanks, Melissa. Hey, guys, Food as Medicine. This is the first year we're doing this, and we're really excited about it. HLTH decided to make Food as Medicine as a priority this year at the conference, and we decided to sort of dovetail that and create our own category. We have 12 other categories. We've never done Food as Medicine, but we've been asked for it a lot of times. So we added Food as Medicine this year, and we actually added another category, Dental. We ended up getting literally hundreds of applications for Food as Medicine companies. They are amazing. And we're now down to just 11. And these are the 11 finalists. They're all our finalists. Most of these companies are going to be at HLTH. At the show, we're going to award three of these companies will be winners, most likely. And we're really excited about it. What's the point of today? Today is a taste for these companies to sort of show what they got and spend maybe 45 seconds. Tell them what are you, why are you going to win this thing? And then we've got a few questions. My role is I'm just a moderator. But I'm really excited to be here. This is the first time with this group, and I love this category. It's near and dear to basically everyone's heart. Really, with that, I'm going to kick it off and just say one more thing. And the only other thing is, remember, we are the Digital Health Hub Foundation, so we really want to focus on clinical value adds. Like when we think of food or medicine, we're not talking about just something you can pick up at Albertsons or Safeway or that. This is really where food making a difference. This is at the HLTH show, and they're going to be, Food as Medicine pavilion is surrounded by tons of other pavilions that are focused on sort of deeper healthcare. So that's what you're going to see teased out by a lot of these companies. We're going to start with Sam at BiteWell, and Sam, it's all you.
Hello, I'm Sam. I'm the CEO and co-founder of BiteWell, and I'm not a healthcare person. I'm a consumer strategy expert. I came from the beauty industry, but I am a patient who has suffered from health conditions where food has been a really meaningful intervention. And that is why I built BiteWell. BiteWell is a nutrition technology company that improves the health of Americans with chronic conditions. What does that all mean? Well, we realized that we were using the wrong metric to measure food's impact on health. So we built a new one called the BiteWell Food Health Score, a nutrition scoring system that is clinically proven to improve your health through food. Thank you.
Nice. I love it. Right. Okay, Ashley from Farmbox.
Hi, I'm Ashley Trenier. I'm the founder and CEO of Farmbox RX. And Farmbox RX uses food as engagement to engage health plan members to move the needle around their quality measures for the plan. So think things like pushing them to go get their diabetic eye exam, maybe their A1C checkup, maybe it's just a primary checkup for CHIP population. And we really feel that we're here today because we've really laid the groundwork for other companies to come forward and work with government entities within the confines of government programs. We were the first to market in 2020 using food as engagement, but not necessarily in the clinical way of looking to reverse type 2 diabetes. Nice to meet everybody.
Excellent. Thank you, Ashley. Now we're going to go right to Nourish. Aiden, take it away.
I'm Aiden. I'm the co-founder and CEO of Nourish. Nourish is a food as medicine platform that connects chronic condition patients with a telehealth registered dietitian, a mobile app, and medically tailored food, all covered by their health insurance. I got interested in this world originally as a patient as well. I had pretty severe chronic migraines, and my worst point was having them daily. And so, of course, it was the number one thing I was trying to solve in my life, and ended up making my way through the healthcare system, primary care and specialists and tests and medications, but ultimately was only able to solve it after changing my diet by working with a registered dietitian. And so through that process, got passionate about expanding access to that type of care to other types of patients like me, and of course, starting to tackle the wider healthcare problem in the United States that we're all aware of and working on here.
Excellent. Okay, we're going to switch over to we're going to for Nourish to Nourished RX, and so take it away, Lauren.
Great, thank you. So nice to be here and see a lot of friendly faces. So Nourished RX is an integrator. Our platform connects the key stakeholders in food as medicine to really deliver a comprehensive B2B2C plug-and-play solution for payers. So we're blending technology, food, and people to really foster lasting behavior change and drive objectively measured clinical impact. And so by leading with food and employing human-centered participatory design, we're building trust and driving engagement in ways that traditional healthcare cannot. And so we should win today because all boats rise when we work together in value-based care. Nourished RX is making this possible by coordinating and amplifying otherwise siloed food as medicine solutions, and also supporting community-based organizations and food systems. And so together, we are transforming lives across the United States, from Somali mothers in Minnesota to veterans in Michigan. And by integrating nutrition into healthcare at scale, we are flipping the $4 trillion traditional sick care model on its head.
Nice. I love it. Okay, next up is Mikal from Pack Health.
Hi, everyone. My name is Mikal Lewis. I lead our strategy at Pack Health. And Pack Health is a digital engagement platform. We're really focused on behavior change for chronic conditions like type 2 diabetes, for example. And in our Better Food for Better Health program, we're focused not only on adherence to healthy foods, but also everything that comes before that: accessibility, affordability. And, when we think about it and we break down the behaviors related to healthy eating, it goes from purchasing to preparing to portion controlling. There's a lot of elements in there that make that really complex. So we partner patients one-on-one with a health coach to create a meaningful relationship that can help guide the patient to those healthy behaviors. And I do think we should win because we do have proven published results that we're excited to talk more about.
Nice. That's perfect. Josh, we're going to go next to you about Fresh. Take it away.
Amazing. Glad to see so many friends here. Hey, everyone. I'm Josh, the CEO and one of the co-founders of About Fresh. I started out my career as a health worker and health equity activist, and predating kind of the commercial market for food as medicine. I founded About Fresh in 2013 after encountering food insecurity up close within my patients. So we're a national nonprofit that's been working for 10 years to just put food into reach for low-income, food insecure households. And over the last 5 or so years, we've been really thinking about how to address affordability as a barrier toward healthy eating. So we developed a financial technology platform that's called Fresh Connect that does just that. It is a platform and a debit card that can be programmed with medically tailored spend parameters integrated across a national network of grocery retailers. Makes it really easy for anyone within a health system or a health plan setting to put money onto a card that a patient can use to go shopping for healthy foods where and when they want, aligned with their healthcare goals. Really excited about all this work and to be here with you all. Thanks.
Perfect. Next, we've got Noah from Olipop.
Thanks, Mark. I appreciate you having us and welcoming us in the final round. And it's great to see again, like many have said, some familiar faces. So I think the first question probably everyone's asking is, what is a functional beverage company doing in the food as medicine space? And, it's the journey to today is really the genesis of the co-founders, Ben and David, and one of their big kind of like North Star goals, which is really making health accessible to millions of people and meeting people where they're at. And we are probably the newest company on the block as far as thinking about the food as medicine space. We really just started moving into this space this year, but we're trying to make up for some lost ground. So one of the core tenets of Olipop, for those of you not familiar, is it looks, tastes, and feels exactly like soda. It has 2 grams of 5 grams of sugar, 9 grams of prebiotic fiber. And as we started learning about the food as medicine space, one of the things became very glaringly obvious. It's that everyone is solely focused on the food side, and that sugar-sweetened beverages account for a vast majority of added sugars in every American's diet. And actually, in talking to different companies and different stakeholders, one of the things that we've heard quite a few times is that even though they're deploying food, wrapping a care team around members' health, that they still have members that are wanting to consume sugar-sweetened beverages like soda. And so we feel that Olipop is the complement to the food as medicine offering by offering a beverage as medicine solution.
Next is NutriSense, and Kara Collier, take it away.
Thanks, Mark. Excited to be here. I'm a co-founder and I lead our clinical operations at NutriSense. I am a dietitian by trade, so I've worked with thousands of patients before starting NutriSense, and I really learned 2 things in those experiences. One is that metabolic health and insulin resistance is often the root cause of most chronic health conditions, and food can truly address those metabolic health issues. However, the second thing I learned was that often by just providing a meal plan or education wasn't enough to actually lead to lasting change and get those health outcomes we were looking for. So when building the solution at NutriSense, we took those into account. We use continuous glucose monitors to provide real-time feedback that drives motivation and powerful insights into your health and nutrition. And then we layer one-on-one registered dietitians on top of that, because that human element is important to make that data meaningful. Because of this, we're able to really transform how people think about food and be able to prevent, manage, and treat health conditions.
That's great. Thank you, Kara. Awesome. Next up is Mark Walker from Performance Kitchen.
Mark Walker, Chairman and CEO of Performance Kitchen. We are a leading medically tailored meal company focused on same thing everybody else here is focused on, the food as medicine space. So I got into space because I'm a finance guy, and I looked at the numbers initially and said, this is an unbelievable problem that we have. We spend $4.5 trillion a year on a problem. And then you look at the solutions that are in place, and almost every study that you see in a controlled environment where food actually reduces cost of care by a significant margin. And so the challenge is, as you guys all know, is that we got to get from here to there. We've got a drug that's close to 100% efficacy. If we were having a controlled environment and put somebody in a room for 90 days, 100% of people get better, right? The problem is we can't do that. So we are all coming up with solutions to attempt to provide a better solution. What we provide to that at Performance Kitchen is a higher quality product. We were rated the #1 frozen food in the country by Consumer Reports. And that is such a crucial part of this, because when you start feeding somebody food, especially for long period of time, which we're focused on, which is chronic meal intervention, you can't expect somebody to eat something 2 meals a day, 3 meals a day for 12 weeks without it being high quality. So we're constantly making that advocacy position with payers. As obviously you guys all know, payers want to reduce the cost. Our argument is, no, you want it to be effective. And so the question there is, do you want to feed them something that's not edible, or something that's high quality that they will eat to sustain the effectiveness of the program? So that's what we do. And again, same thing with Lauren. I'm such a big advocate of the industry overall, because we all have a responsibility to prove out what works and what doesn't work, so that the $100 billion, $200 billion industry can flourish. So that's what we do.
Mark, pretty cool finance guy. Most people don't start with, hey, I'm a finance guy, but you can pull it off. Next would be Eat Love and Monique.
Hi, everyone. Yeah, I'm Monique Nadeau. I'm the co-founder and CEO of Eat Love. I'm a recovering investment banker, formerly worked on the Affordable Care Act, and I'm trying to get into heaven. So super excited to be here with all of you. So Eat Love's AI-powered nutrition intelligence technology is uniquely positioned to make food as medicine scalable, affordable, and personalized for everyone. We do that in 3 ways. Firstly, we connect clinical recommendations to everyday choices. So our adaptive operating system guides the 200 decisions we make around food and diet every day. We do that based on 5 million dietary factors, whether you're cooking at home or dining out. We looked at every meal choice within the context of your overall nutrition needs and lifestyle. Secondly, we scale clinician impact. Over 8,000 physicians, dietitians, and other qualified clinicians use Eat Love to deliver clinically validated nutrition prescriptions based on up to 100 macro and micronutrients, supporting 97% of all health conditions. So whether it's from PCOS to diabetes to recently launched GLP-1 Nutrition Companion. Our Pro platform automates routine tasks, allowing dietitians with our value-based contracts to support 5 times more patients and enable other clinicians to be able to provide evidence-based care within their scope of practice. With only one dietitian, this is what I learned with working on the Affordable Care Act, with only one dietitian per 5,000 Americans, we need to find ways, innovative ways to be able to expand our current workforce. And then lastly, Eat Love partners with major grocers, ready-made meal providers, and has access to about 10,000 restaurant meal options to deliver precision nutrition. We recommend currently over 1 million meals a month, and we leverage massive supply chains to dynamically create medically tailored meals for an average of less than $4 per serving. That's our awesome. Collaborators such as Mayo, USC, and Midland Health are able to provide that for their patients.
Good. Love it. Thank you, Monique. Sounds great. Last but surely not least is Mend. Liza, bring it on.
Thank you, Mark. And I get the enviable position of going after such an incredible peer group of folks. Inspired by each of you, the industry and the world needs us. So congratulations on what you're doing. Look, this is deeply personal to me. My mother is a 2-time cancer survivor who's had two surgeries to mastectomies on her breast. My fiance has had multiple run-ins with the health system. My brother had a very serious fall upstate from Catskill Falls, where to have 8 surgeries to repair his body. I had an injury that was very serious, slow to heal. And the common theme in all of this in the recovery was there's a total absence of nutrition being utilized to fuel the healing process. Huge body of evidence. We're the only company that has significant body of evidence published in the space. We're having clinical impact. If you go into Geisinger in the last 4 years and have a major surgery, the hospital is paying for you to have Mend. And now leaders like Hospital for Special Surgery, leading surgeons across the nation are utilizing Mend. And we have provided, along with that, a behavioral model to really provide an extra level of care to patients as they go through that perioperative journey. So it's an honor to be here with you, and an honor to have this discussion. Really excited to tell you more.
Excellent. Good. Guys, that's great. So that was the first part. Now we're going to get into the second part. The second part is I've got 2 questions. Now I'm going to basically give half of you one question and half the other question. We're going to then see where we end up with the time. I'm going to go right to where we started with BiteWell. And so, Sam, you get the first question. What's your proprietary mode or your medicine that can't be, that I can't basically just walk into a Safeway or an Albertsons and buy?
So, really interesting question. I think what's special about BiteWell is that we actually don't compete with any of you on this call. We are the data rails on which food as medicine is built. And so we have built the largest food database in the country, maybe the largest in the world, we don't yet know, of clean nutrition and ingredient information on individual foods and meals. We've then built a proprietary scoring system that sits on top of that food data and matches you to both the dietary protocol that is of highest efficacy for your individual body's needs and goals, and then scores food based on how well it meets that dietary protocol, so that all of us in this call could be looking at the same oatmeal bowl with blueberries, and we all might see a different score because my body has a different need than your body and yours. And Excellent. It's through this clean data and understanding of the food supply system that we can make change on both ends.
I'm going to throw this one at Olipop because I know a number of you already asked me the question is like, what are these guys doing in this thing? Noah, I want you to tell me why, you talked about getting into food and medicine. I want you to amp it up. Why are you really leaning into medicine? Tell me about it.
Yeah. So I think again, very, very similar to what Sam from BiteWell said, Olipop is the complement to what every company here is doing. You guys have a major problem in getting people to stop drinking soda and sugar sweetened beverages. With the growth of Olipop and some of the data that we have showing switching behaviors away from soda and sugar sweetened beverages, we know people can change. We also know that based on SNAP data, as well as being a part of all of the major supplemental benefit programs, and some of the early pilot programs and data collection that we're gathering with health plans and other folks in the space, that we're driving also meaningful engagement. And so whether it's engagement or food as medicine to complement the programs that integrate into an algorithm or integrate into a recommendation system, there's no solution that solves for soda and getting people to stop drinking sugar sweetened beverages. Soda has a 97% household penetration just in SNAP alone, which shows that we appeal to every demographic. We're not just a better for you product, that we grew at 140% year over year. The final thing I'll share, Mark, is that, you know, you ask, what can people not get at Albertsons? I would argue that one of Olipop's superpowers is that we're available anywhere and any way people want to shop, and can be deployed very easily across partner programs like a lot of the folks on this call, or through other solutions. People can get it in a store, they can get it online, they can get it on Amazon, or they can get it through their supplemental benefits. So we're highly approachable, reducing the cost and helping solve for one of the biggest problems, which is sugar still contributing to metabolic health crisis.
All right, so I'm going to get the finance guy, Mark, back on the line here. Performance Kitchen, I want you to answer the same question. Tell me more about your moat and your medicine.
As we all know, this is one of the challenges we have with everybody, because everybody thinks food, everybody does that, that's easy. Well, not so necessarily. So I'll probably list 3 or 4 of them, one of which is a little embarrassing, a little braggadocious, but we've been so early in this space that we actually own the trademark for food as medicine. Because 5 years ago, when we looked at it, we said, this is incredible. This is amazing. As soon as the industry can get around to doing this, this is a big deal. So the quality of the product is another one. This is something that a lot of people, especially payers, underestimate, is the value of the product as far as adherence goes. There's a lot of the service groups in here understand it is one of the most difficult things in the world to get people to adhere to a program over a long period of time, because no offense to Olipop and Noah, but Coca-Cola is good for a lot of people, right? And so we're fighting this addiction issue that we all have, and it's been forced upon us, or let's just say suggestions. So that's another one, is the quality of the product. The third, which I think we all have, are contracts in the space. I don't think people realize how, I'm not going to say lazy, but how little desire payers have to switch contracts once they have a working solution. So once you have a working solution with a payer, they don't want to move, right? There's lower quality products than all of us out there that still have contracts with payers because they're just used to it. So the contracts are very, very important, because you can't really deploy a food as medicine paid benefit without the contracts that exist in the industry. So we have 20 plus contracts right now on the medically tailored meal side, and we're working on other things that are going to be launched in the next month or so that
okay, that's awesome.
That are important.
Mark, thank you. We're going to switch. We're going to go to Farmbox RX, and Ashley, I'm going to ask you the other question. The other question was, give me a case study that you can cite that really proves that your food of medicine is better than just medicine.
So we have a white paper out that we did with Molina Healthcare of New Mexico. It was for a Medicare population, also low income, as dual members. And we had 367 members in this white paper. 100% of them returned the health risk appraisal. And that's not a typo. It was 100% returned the HRA. 59% of members went and had their diabetic eye exam. There was a 10% increase in breast cancer screening, a 23% increase in other really hard to move HEDIS measures like HbA1c testing. I think one of the biggest pieces that came out of this white paper that we were not even trying to study for was there was a 9% decrease in unnecessary ER admits. And it's commonly known that someone runs out of SNAP dollars at the end of the month. They go to the ER in order to just try to get a meal. I think one other really important measure, we do a lot of work within CHIP populations, is we had a 7% increase in lead screening, which is actually one of the most difficult quality measures to move for the adolescent population.
Nice. Perfect. I'm going to go, Lauren, for Nourished I'd love you to answer that same question. What case study can you cite that proves that your food of medicine works better than just medicine?
Sure. Well, to start, unlike medicine, our intervention has no side effects, drives lifelong change, and advances health equity, all at a fraction of the cost. And so it's actually hard to pick one case study because across the 12 healthcare payers we've worked with and the 10,000 members we've worked with, there have been a lot of great stories. But one case study in particular comes to mind from a diabetes program we ran with a Midwestern payvider. An independent research team found that after just 4 months, participants saw an impressive average A1C reduction of 1.3. But even more encouraging, a year after the intervention ended, they found that the reduction had not only held, but had further improved, reaching an average total reduction of 2.3. So clearly this was an example of lasting behavior change. And one of the members, Martha, who actually also serves as one of our consumer advisors, shared how that program really opened her eyes to how unknowingly processed foods had just really contributed to her family's poor health over time. And the quote I love is, "No more insulin for me, and the world feels a little more fair."
I love that answer. I'm going to then, Mikhail, I'm going to go to you. I'm going to go to Pack Health. Now, you guys are a part of Quest. We all know Quest. So I want to hear about the Pack Health solution. But again, tell me about some case studies. Why are you guys doing this? And why is Quest in this business? And why was it really important for Quest to do this?
Yeah, no, a great question. So I'm going to start with the Quest piece just to kind of hit that. Quest saw Pack Health as a vertical integration. So one thing that we are focused on is continuing to innovate on our products. And so I think a competitive advantage we have is that Quest does have 1 in 3 data points on Americans. So how can we take that lab clinical data and then take action on it? So Pack Health is considered a beyond the lab service that Quest is expanding on all the time. And to get back to the case study piece, Pack Health actually prior to the acquisition did complete a case study with Blue Cross of North Carolina, which was published last March in the New England Journal of Medicine, where we had over 880 participants in a large 6-month pilot focused on those managing type 2 that were identified as potentially food or nutrition insecure. Through that work, we collected a lot of patient-reported outcomes and saw some decreases in BMI, along with increases in mental health and other pieces like that. But I think the big point is that we did see those that participated in the program had about $139 per member per month reduction in total medical cost. And if you extrapolate that out based on the analysis that we did, we expected that to even be a potential reduction of about $8.5 to $13.1 million annually for that plan. So again, something that we are continuing to innovate on through partnerships and getting more clinically aligned is how can we continue to bring these proven results to the market?
Good, great answer. I think now, hopefully I'm not going to mess this up and double down. Monique, I don't think I've asked you a question on Eat Love. And I want to get back to you, which is, tell me about your proprietary moat a little more, your medicine. What's so different and unique about what you guys are doing at Eat Love?
Sure. So what makes us unique is the fact that we actually go down to the macro and micronutrient level. And that's really important because we talk a lot about what is a nutrition prescription in a very general term. But when you think about the DASH diet or the MIND diet or what's appropriate for someone with comorbidities, what we find is that being able to have the right food in the right amount over time is really important for driving outcomes. And so the fact that we can go down to that atomic level, and we actually spent 3 years in R&D to be able to do that, means that large health systems, employers, clinics will use Eat Love to be able to actually prescribe food and to be able to do that for 97% of all health conditions. So if you are, to give you an example, if you are an individual with PCOS, with with PCOS, with insulin resistance, you have a child who's allergic to tree nuts, you like to eat oatmeal for breakfast, you're on a budget and you only have 15 minutes, Eat Love's going to be the platform for you. And knowing that we find that the diets that folks and the food that people choose are the ones they can actually follow. So if I could, I want to tie into the question that you asked about why can't you just buy it at Albertsons? With Eat Love, you actually can. And I just want to make that distinction. The fact that we have and we're built upon almost 1 million foods, we create medically tailored meals dynamically and create combos in a way that actually ladders up to a nutrition envelope for each one of those health conditions.
Nice.
And
That's awesome. And thank you for bringing that part up. So we're going to go to Mand. Zaya, I want you to basically answer the question, the case study. I want you to go back to the case study. What makes your food as medicine work better than just medicine?
Yeah, I mean, Dr. Paul Wischmeyer of Duke, who is the most published and leading author in all of perioperative medicine, says $1 invested in our solution can yield hospitals $52 in return. We have published clinical evidence in leading journals that shows lower mitigation of muscle atrophy or reduced muscle atrophy, better return to function, better discharge, better wound healing. The patient has less nausea, is back up on their feet better. And there are billions and billions and billions of dollars in costs that are trapped in poor outcomes as patients become more complicated, as they're older with comorbidities, obesity. The risk of readmission is higher. We need interventions like MEND deployed in mainstream medicine to have that impact on clinical outcomes. And we've demonstrated that in leading institutions that are using our solutions.
Nice, great answer. Kara, I don't think I've asked you the question in NutriSense. If I have, you get a second question. Hopefully I didn't ask you this one.
You did not.
All right, then your proprietary moat, and what's your moat that basically makes you guys so different?
Yeah. So our moat, we're doing 3 things in combination that no one else is doing. One is accessibility to these continuous glucose monitoring devices. And 2 is layering on that data, additional data sources, and that one-on-one dietitian coaching to make the algorithm recommendations for your diet intake even better. And then 3rd is internal tooling to support our dietitians at scale. So just doubling down quickly on each of these CGM devices we have found to be extremely powerful in driving meaningful behavior change, but historically they've been very hard to access. So we have exclusive contracts, as Mark has mentioned, is extremely important with these hardware manufacturers to be able to make the access easy and accessible to many, many more people. On top of that data, the continuous glucose monitoring data, which tells you what you should eat at different times of day, different seasons of life, different situations, we also layer on that human expertise, which are the only dietitians who are specifically trained in metabolic health and continuous glucose monitoring interpretation. And then we ingest other data sources like labs, wearable metrics, microbiome results to pull together and give you even better dietary recommendations. And then lastly, because we have millions of conversation data set between our customers and our dietitians about their health, their nutrition, their glucose levels, we've been able to create internal tooling that makes our dietitians even more efficient and effective, because we know that human component is so important, but it's expensive and it's difficult to scale. So by having these machine learning models, we're able to really scale and make internal impact and to the masses.
Perfect. Josh, I don't think I threw your question, did I?
You have not, no.
Oh, here it comes. All right, you're gonna get the softball. What's not a softball? Tell me about your proprietary moat. What makes you guys really, really different, and something that people haven't historically been able just to sort of, pick up at Safeway?
Yeah, sure. I mean, it's not technology. As I mentioned, I was a health worker prior to About Fresh, and the first program that we developed back in 2013 was a mobile market. We operated converted school buses as grocery stores, so it doesn't get more grassroots than that in terms of getting close to the problem that I think we are all attempting to solve for the folks that need it the most. We've really come from a place of ground up social innovation, and obviously our thesis around just getting food into neighborhoods is a little bit misguided relative to what it is that we're doing at this point right now. So our moat really comes from that 10 years of just on the ground operating experience at the intersection of food activism, food security program design, and clinical care, from having been a health worker and experience all the friction that comes along with attempting to connect patients with a non-clinical, social program. And that's really materialized for us on just like an outsized focus on the patient experience, once you get into that retail setting, making it really intuitive for people to understand what they can buy with the Fresh Connect card. And then I'd say more than anything else, which often goes underrated in our category of like directed spend, sort of like fintech programs, just a super reliable and frictionless transaction experience at the point of sale. So we're not getting into a situation where we are breaking our covenant with our healthcare partners and allowing, you know, people to purchase foods that are misaligned with their healthcare goals. And that we're also ensuring, more importantly, that all of our cardholders can buy exactly what they expect to be able to buy.
Give me a case study. Give me a story, you know, real quick, 15 of a family that basically was able to take advantage of About Fresh, and you were transformational.
Yeah, sure. I mean, the fun part of my job too is I get to be really up close and oftentimes like buddies, like friends too, with a lot of the folks that we serve, just where we came from. The stuff we think about a lot is culture. So I'll tell you too, like my friend Janie, who's enrolled in Fresh Connect, who unfortunately has passed since too, told me a story too of just over lunch, like how she got to go home for Christmas, because we've seen that increasing purchasing power for food leads to broader gains in economic stability, right? When we think about those other critical expenses. And then I think also family meals, that breaks down. If you're food insecure and you can't afford to feed yourself or your family, you're optimizing for just hunger, solving for hunger, like you don't get to do birthday parties, you don't get to do family dinners, you don't get to do cookouts. And so I think that story with Janie, having the opportunity to celebrate Christmas and her cultural foods is that's the endpoint impact for me.
Nice. Got a few more minutes. I'm going to throw the same question. I'm going to, Kayla, I'm going to throw it at you because it's, again, I'm just so intrigued with your Quest's reach and the ability to sort of, you know, get Pack Health in a whole new bunch of new places. Give me a case study. Give me an example where basically Pack Health basically transformed. Maybe it was a typical Quest customer who didn't realize it. Basically, all this was available to them. Blow us away.
Yeah, no, sure. So another case study I would mention is that, you know, a lot of times, Josh brought up a great point that one thing that I wish we would have a better hold on is the household impact that it can take when you deliver a box of food or you deliver or get a, you know, delivery of food sent to somebody. And so I'll never forget this. We had a member in one of our case studies that, you know, had mentioned, I don't know what I was going to do to find my next meal if I hadn't have known about this program. And it came through, you know, my insurance company. But I don't think you understand the impact beyond just myself. I mean, it was a family of 4. And so that's something that's always stuck with me is essentially this person was able to leverage their resources through their insurance. That was a Pack Health guided program to understand, you know, how to use the food and just, you know, have access to something that they wouldn't have had access to in the end of the day.
Hey, Lauren from Nourished, I'd love to hear your answer. Give me a case study. Give me something you're, you know, basically a family or an occurrence, something you guys are super proud of that you can share.
Yeah, sure. So I talked about our diabetes program, and I talked about Martha. I'll give you another one. There was an individual, a gentleman named Mike, lived in Indianapolis, and he had diabetes, kidney disease, heart failure, and he was depressed. And we worked with him. It was a progressive journey where we started with healthy meals for him to recognize how much better he could feel eating healthy food. He then graduated to groceries. And ultimately, you know, through all the digital resources and education that we have and registered dietitian consults, he just became an advocate for healthy eating. And he actually, he talked about the fact that his mother and grandmother used to tell him that a spoonful of sugar was the trick to practically everything. And he started substituting blueberries in his vinaigrette and was teaching, you know, teaching people all about it. And actually last year when I was presenting at Health, I was actually pitching to Health, could we get Mike up on stage with me? Because he had originally worked in Las Vegas as a blackjack dealer, and he was no longer housebound and depressed. He had actually gotten an RV and he was driving cross country and would be willing to stop in Las Vegas to join me on stage.
Nice. Great. That's a great story. Well, I'm looking for 1 or 2 more stories here. Okay, who wants to tell a story? Let's make, I want to hear a great story. All right, Monique, your hand went up. Let's see it.
So I was just thinking about Tara, who had reached out to us. She had a pretty poor relationship with food growing up. She didn't know how to cook. She didn't want to cook. She was eating at fast food. And so for most of her meals, and she reached out to me. She found my information on LinkedIn, and she said, listen, first and foremost, I learned how to use Eat Love, where I just used one meal a week. That was it. It was one meal a week. Think about, imagine Spotify for food. Eat Love produces a meal list, and you could do one meal or you could do 25 meals. And she said, I just want to do one meal. And then she added, she goes, I just want to batch that. Then it was, and being able to feel, to be able to add her own health conditions and generate what are some of those options, she then was able to say, okay, I can actually go to Starbucks. And the fact that we could map her nutrition prescription of what she was eating at the nutrient level, again, not a general scoring level, she was able to eat according to that. And she had lost 87 pounds over a year.
Okay.
And when I asked her, I said, what's the benefit? She said, now I can actually feel comfortable in a wedding dress, and I really want to get married. And she's like, I'm really excited. And I didn't even realize that my partner had also lost 50 pounds through this
Great.
process.
So these are the, what Monique just said. You know, I listen to all of you companies, and it's like, this is the beauty of this. This is why this category, which is why HLTH is so excited about bringing this, you know, front and center, you know, in Las Vegas, that so many of you guys are doing exactly what the types of things that Monique has been talking about. All I want to say is we're 50 some minutes in. I always like ending early because basically our judges just assume get what they really wanted. I think we've gotten some really good content here, and I'm really excited about that we have done that. I want to suggest that if you guys don't really know each other, I know some of you do, we're going to reintroduce each of you to each other. It's basically the community, and it's our working together. And this is what we found out, you know, at for the awards, is that we actually smush our finalists together. We say, guys, you guys gotta get to know each other. You guys got to work together, because basically it's, you know, all of this, it's a journey. It's hard. We've got to, you know, we're trying to change the world. So we really, you know, we want to encourage you to change the world and to keep it going and to do some great stuff. This has been a great panel. We've got the content. You guys are all winners, of course. You know, I'm going to say that. And we're going to see you in Las Vegas. And thank you so very much. And Melissa, is there anything else you want to add?
That is all. I'm just going to share this slide really briefly for everyone in the audience. Bear with me as it's just pulling up. Make sure to join us on October 21st at 5 p.m. on the disco stage to be able to hear who will be crowned as the winners of this inaugural Food as Medicine space. When it comes up here on the screen, you can click on that QR code. We've also obviously sent a ton of emails, and it's up on social. But we'd love to see you there to cheer on these companies.
Thank you. See you in Vegas. Great panel. I'm really excited we're doing this award. This is going to be amazing. Have a great day. We'll see you guys later.